Hi, Venus. This is Dr. Srikanth from Team mdsconquer. Now, I'm going to give a brief idea of how you need to handle, how you need to approach, and how you need to finish and focus general surgery. So, hope you remember this particular subject in your third year, okay, among the list, along with oral path and general medicine. So, general surgery, according to the NEET blueprint, is going to carry somewhere around a score of 14 marks. And it has a decent weightage in the AIMS and PGA and JIPMER too. So, the regular approach is, even if you have a look over into the recent NEET, that is 2020, a trend setting or a modified paper or a modified approach NEET, most of your general surgery questions, excluding few topics, were questions of your oral surgery. Means you cannot differentiate a question of general surgery from oral surgery, because Ludwig's angina is a common topic for both of this. And similarly, there are many other space infections which are common for both of this. Cavernous sinus thrombosis will be discussed in both the subjects. And most of the trauma cases will be discussed in both the cases. Fluid replacement, most of the things will be discussed in both. So you cannot differentiate a question of a general surgery, like a few questions of general surgery, from the oral surgery. So taking this into consideration, I have divided the subjects exclusively, the subtopics exclusive to that of the general surgery. So going into my schedule, okay, first I want to describe the topics. Okay, so I have differentiated the topics into red, blue, and green. Okay, so green topics are the topics which are not only specific to general surgery. For example, if you take the diseases of salivary glands and the infections topic, okay, these are common for both your oral path, oral medicine, general path, general medicine. Everywhere you see the diseases of salivary glands and infections, even it is common for your oral surgery also. And same goes with the wound healing and repair. Okay, these are common things for your general pathology. These are common things that you encounter in your oral surgery also. Okay, so these things are common for most of the subjects. Okay, common, and these are important topics too. And coming to the red topics, which are exclusively for your general surgery, means diseases of thyroid. Maybe you may learn about the symptoms in general medicine, but the surgical aspects or the carcinomas of thyroid gland, which is the most commonly asked for question for you in the general surgery, will be exclusively to your general surgery. And similarly, you have topics like cysts, ulcers, swellings of head and neck. Apart from the oral cavity, what we discuss in your general in your oral medicine and oral path, there are many other cysts which move around head and neck, which has to be covered here, which is an important topic to be focused on. Diseases of larynx, esophagus, and pharynx, of course they are a part of your general medicine, but surgical aspect will be learned in general surgery. And your venous and arterial diseases, all these are a part exclusive to that of your general surgery. Whereas coming to the topics like this, transfusion reactions, shock, hemorrhage, burns, fluid, electrolyte replacement, nutrition replacements are common topics for your general medicine. Tracheostomy is a common topic which we encounter in the emergency things. So the most focused thing in the general surgery, if you take into consideration into the NEET or the AIMS, okay, AIMS, most of your diagram based questions will move around general surgery exclusively. Apart from including general medicine, your tubes, or most they regularly ask about the tubes, suturing techniques. Okay, they ask you about the knots, and all these are mostly related to general surgery in comparison to subjects like your oral surgery and the period. Okay, most of the surgical stuff will be asked from a general surgery point of view. So this is a brief distinguished topics that you need to cover from general surgery. Okay, so I have given somewhere around 12 days for your preparation, which is more than sufficient to focus mainly on the important topics in general surgery. So I have given 2 days for you to cover the diseases of thyroid, parathyroid, adrenal. 1 day for the salivary glands and infections, followed by 1 day for transfusion, shock, and all this stuff, followed by 1 more day to cover tracheostomy and wound healing and repair. 2 days for cysts, ulcers, swellings of head and neck. 1 day for diseases of larynx and pharynx and esophagus. 1 day for AV diseases, disorders, and followed by 2 days for your revision and image based stuff, and followed by 20th is going to be your exam. So this is a rough plan of action to handle your general surgery. The books to be followed, the things to be done, where to be done, how to be done, in how much time to be done, and you will have examination. This particular, I want everyone to prepare this particular table and stick on to your uh, room, okay, where you're preparing, or you can stick on these to the first page of your notes before you start general surgery. I want everyone to drop your scores because I'm planning to keep every exam, every day you'll have an exam, okay. So once you're done with 9th and 10th, on 11th morning before you start this particular topic, you need to finish the exam and you need to drop the score, okay. How much, for example, if it is 25 marks, how much is for 25 marks? So I want this analysis that everyone has to, including your final exam, that is a grand exam on general surgery analysis also, okay. So once you're done with this, this should be on the first page of your preparation of general surgery notes or anything, and on the last page before you end with an exam, because the last one is the exam on 20th. Once you're done with the exam, I want everyone to write about the review of your preparation of general surgery, like what topics you have done, what topics you are good at, what topics you are bad at, what topics which are not done, what is your score, why you got a bad score, what is the reason behind your bad score, or what is your reason behind the questions where you lost, and everything has to be written by you, so that once you are coming back to general surgery again for revision, that review is going to give an idea that where you are weak at, and you can focus on such things, okay. So the review is must for every subject. Once you're done with a particular subject, make a note. Once you're done with the grand exam, write about the review, your personal analysis over your preparation relevant to that particular subject. So this is going to give some sort of hint that where you need to focus when you're starting with this subject again in the second or third rounds of revision. Okay, hope this video is informative and gives some modifications in your preparation pattern to focus you more on your preparation and how to improve your scores and everything. Are all these are microscopic things that you have to focus on, okay. Reading, writing, giving an exam is one level, but once you are in the competition zone, you need to be first among the list, okay. So if you want to be first, you need to have a microscopic analysis like this, a micro analysis, like where I am losing, where I am hitting wrong. So you need to focus in this particular way. So apart from this, we are planning to have multiple case based discussions, okay. So case based discussions are like connecting the stuff to one another. Means you are going to connect one question on a particular disorder in a particular system to the other question in the case based question. For example, if I'm talking about Ludwig's angina, so this tumor is also called as, this tumor is most commonly due to the infection of which are the following organisms which causes infection, how the patient will look clinically, a diagram based question, what are the emergency procedures that you are going to do, what is the antibiotic prophylaxis that you are going to do, what are the emergency precautions that you are going to take. All these are connected questions like related to Ludwig's angina, and if you convert all this information into one question, that is called as case based question. Means a multiple single liners or a multiple open-end questions will be covered in a case-based connective question. So if you have a look over into the recent NEET, okay, that is 2020, most of the things are like case-based questions, where they're connected to one another. So if you read or approach, and if you do the things in case-based approach, it will be easy for you to retain for longer duration of time, and it will be easy for you to handle in the examination hall. Thank you all. Signing off, Dr. Srikanth from Team MDS Conquer.